Hi, I'm Captain Rob Tasato. I'm the Director of the Medical Reserve Corps. In this role, I advise the Surgeon General and the Assistant Secretary of Health on issues of civilian volunteers and their participation in public health, preparedness, and response activities, and I work daily to promote, strengthen, and sustain the Medical Reserve Corps. So, what is the Medical Reserve Corps, or MRC? It is a national network of local groups of volunteers who are dedicated to strengthening public health, building community resiliency, preparing for, and responding to emergencies. Launched in 2002 as a way for medical, public health, and other volunteers to improve the health and safety of their communities, Medical Reserve Corps units are now in every state and have organized hundreds of thousands of volunteers. MRC units also promote the priorities of the Department of Health and Human Services and the Office of the Surgeon General while focusing on the needs of their individual communities. MRC units prove their value to their communities in numerous ways. For example, they promote individual, family, unit, and community preparedness through trainings, drills, and exercises, as well as presentations at community fairs and other local events. MRC volunteers are ready to serve their neighbors when disaster hits, whether the cause is natural or man-made. They have assisted with evacuation shelters, alternate care facilities, warming centers, and mass vaccination clinics. They have not hesitated to help when their communities were affected by floods, ice storms, hurricanes, wildfires, or pandemic influenza. MRC units support emergency response activities, but also assist with numerous local public health initiatives. Some of those initiatives include providing education on a variety of health topics, screening for diseases like diabetes and hypertension, promoting healthy eating and exercise to combat obesity, and providing immunizations. There are many reasons for MRC units to support public health. The most obvious is the benefit to the community. Most local health departments have plans or ideas for activities, but often don't have sufficient personnel. MRC volunteers can assist with these tasks and help meet community needs. Assisting with routine public health activities can also help with volunteer recruitment and retention, as volunteers join to help their communities in both good times and bad. Since emergency responses are thankfully infrequent, public health activities keep MRC volunteers engaged and enhance their skill sets. Volunteering on a regular basis sustains volunteer interest, increases their comfort level in their volunteer role, and benefit the community. Engaging MRC volunteers in public health activities can also help to reduce disaster risks by lessening susceptibilities of community members. In general, healthier people before a disaster are less susceptible to injury and illness following disaster. By helping to reduce vulnerability and build resilience, MRC units can play an important and active role in their community's disaster risk reduction efforts. I encourage all MRC leaders to think broadly about the composition and mission of their local MRC unit and to institute strong and effective volunteer management practices. I encourage all community members to volunteer, support, or partner with your local MRC unit today. If there is not an MRC unit in your area, talk to your local health or emergency management leaders and encourage them to support one. With the MRC, you have a unique ability to put your expertise, passion, and patriotism to good use, building, strengthening, and better preparing your community. Visit www.medicalreservecorps.gov to learn more today.